Hello, everybody out there with type 1 diabetes. Today, I'm going to talk about how fat can affect our blood sugar. It has no carbs though, right? Right, but it can still affect our blood sugar. So perhaps you're just finding me for the first time today, or perhaps you've been following me for a while. I've been doing Facebook Lives Monday through Friday. This is probably, I don't know, 60th, 70th, something like that, ever since we are all in this new COVID world. I wanted to come to you live to inspire you and help you with ideas for how to get better blood sugar levels, right? Because getting good blood sugar levels is so key to keeping our immune system strong. And of course, that's so important. I've had type 1 for 40 years. I am going to go for a bike ride after the call today because I prefer to be below 120. And I have dedicated my career to helping people with type 1. So I help patients who are struggling with their blood sugar levels have less highs and less lows so you can confidently live a long and healthy life with type 1. I just hit 40 years actually last week, which is kind of crazy. But there's so much education that's missing. If you've had type 1 for a long time, you could easily not have, whoop, there's Dex beeping at me. You could easily not have received all the education that you need to really know how to have an A1C at 6.5 or below, which is what is suggested by the American Association of Clinical Endocrinologists. I just had a patient on the phone right before this video that says, oh, I'm 7.5, and I've just kind of become feeling, used to that's okay. And that happens to a lot of us. We think a 7 or 8% A1C is okay because we think getting anything better is too hard or it's impossible or we've tried. And I'm here to say it's not. With the right education and support, you can have a healthy A1C, which will make you feel better and make you have more energy and have less crazy moods and irritability and all that stuff that comes with our irregular blood sugar levels. So leave a comment below, by the way, while you're watching, and let me know your thoughts on this video. But my topic today is fat, okay? Fat increases our insulin resistance when we eat a lot of it. Now, if you're gonna have some dinner and you put a pat of butter on your broccoli, you're not gonna see a big difference in your blood sugar level. However, if you have a meal that has over 20 grams of fat, you have a cream sauce on your broccoli, or you have even a salad. It doesn't even have to be unhealthy fat. It can be like olive oil and cheese and pumpkin seeds and avocados and olives and, a salad dressing. You have all this fat, right? Well, what happens is when you have a meal that has about over 20 grams of fat, you can actually have temporary insulin resistance kick in, which means that the insulin that's floating around your background, your long-acting, as well as your mealtime, it's going to be less effective. It's not going to work as well. So you actually need to increase the amount of insulin that you take after a high-fat meal. You might need to increase the amount of insulin you take for 4 hours, 5 hours, 6 hours. Now, this can be done, of course, with a temporary basal increase on a pump. For those of us on shots, I'm on shots. Got my handy little needle and pen right here. It's a little more tricky. I do micro dosing. I teach this in my course, Nutrition and How to Dose, right? Because carb counting alone doesn't work. You can't just count up your carbs, give your dose, and expect that to work. Dosing is not that simple. So I really want you to learn and start noticing when you have high fat, what does your blood sugar level do after you eat it? And if you want more help with this, check out my course, What to Eat and How to Dose, Nutrition and What You Need to Know for Type 1. My website's listed right there, drjodynd.com. And that's my message for today. So I hope you've enjoyed this video. Please leave a comment below and share this video with anybody else you know that has type 1. I am here to help anybody out there struggling with type 1 have less highs and less lows so you can confidently live a healthy life. I'm going to go jump on my bike ride so my blood sugar level gets back down closer to 100, and I will see you tomorrow. Bye for now.